My name is James Moshi, coming from Tanzania. I'm here with my family. I've been in India now for almost a year. I brought my son for treatment, and we're at Mazumda Shore for the treatment. And so far we have done quite a bit of treatment. We've gone through a lot of treatment phases. My son was diagnosed with pediatric cancer, and we've been having the protocol, following the treatment protocol, including surgery, bone marrow transplant, and radiation therapy. And we are now on maintenance doses after the treatment. So we have seen a significant improvement on our son's health and well-being from the time we started treatment here. When we came, he was he was sick. He was not able to mobilize easily, and he was weak. But the treatment so far has been really good. Though yes, the usual, the treatment is quite challenging, especially the nature of the treatment. But we have seen very significant improvement in his mobility, the way he's running around, he's happy, he's having more days where he's no pain, having no pain, and it's something that has really given us hope, and has given us joy, so to speak, seeing him able to socialize and jump and run around. So we would say that the journey has been quite, yes, rough, but very fulfilling, so to speak, and it has given us very good hope, and it has given us comfort, seeing that we will be able to do what we can do for him, and also seeing how the doctors and the entire team here at Mazumda Shore has been very supportive. They've held our hands through it all, through rough times, and they've been able to give us support that is required and care that is required to actually bring us to this phase where we are at right now. And looking at him and looking at where we came from, we are very grateful for the entire team here at Mazumda Shore. My wife and I are very appreciative of the support we've been receiving, consideration, and all the consideration extended to us throughout this treatment to accommodate to our requirements, and the comfort levels to support us through this journey. And this is something that is inspiring. It's amazing for us, and it has really helped us be able to manage what we are going through, being able to balance the circumstances that we are going through, and we really are grateful. My wife and I, and my family, my father, my mother, mother-in-law, father-in-law, they've been here in India in a period of times just to give us support, and all of us as a family would really like to give very special thanks to Dr. Sunil and his team. Been very supportive of us. These doctors have been really kind and really supportive and understanding of our circumstances, and giving us the best they can offer. In all honesty, with our experience so far, and we've done a lot of reading around, and we don't regret the choice to come to Mazumda Shore, come to Narayana Health, and we would really recommend patients that really want that special care, that tailor-made care and support especially bone marrow transplant. Narayana Health is highly recommended. I would personally recommend, because of the experience that I've seen having my son going through the bone marrow transplant, and the support, the care, and everything. We are very grateful in general, very grateful.
Hi, my name is Dr. Sunil Bhat and I'm the Director and Head of Paediatric Hematology Oncology and Bone Marrow Transplantation at Majumdar Shah Medical Center, Narayana Health City, Bangalore. We're going to talk about this young boy called Ittai James who had come here for treatment with us a few months ago. This boy was diagnosed with a very aggressive type of cancer called neuroblastoma, which started from his abdomen but unfortunately had spread to the various other organs of the body, especially the bones. Now, most of the times these neuroblastoma patients, they will require chemotherapy, radiation and surgery for cure. But the patients whom we call as high-risk neuroblastomas, wherein this tumor spreads to other parts of the body, as in this case of Ittai, we do have to treat them with something called as autologous bone marrow transplant as well. So what is autologous bone marrow transplant is that we take the stem cells of the patient and store them and then give them very high dose of chemotherapy post that to kill the tumor cells wherever they are in the body, and then help them to recover from the effects of this chemotherapy with these stem cells which have been collected. Now, in any bone marrow transplantation, the bone marrow stops working for 2 to 3 weeks post transplantation, and these patients need multiple units of blood transfusion and platelet transfusion during this course of admission. Ittai James and his family, they believe in a faith called Jehovah's Witness, wherein they do not allow any kind of blood transfusions or platelet transfusions to be given to the patients. That's what they believe in, and that's the faith they have. So we had a limitation in this child that we cannot give him any blood transfusion or any platelet transfusions. So that's what makes this transplant very unique. This is my first transplant, and probably one of the I'm not aware of any other place or any other unit who has done a bone marrow transplantation without using any blood product in a patient of Jehovah's Witness, and that makes this case very, very unique. So we had to do some special precautions prior to transplantation as well as during transplantation, so that he does not develop any significant problems or complications for want of blood transfusion. So he was maintained on these special precautions, these special medications during the transplant process. And after 2 to 3 weeks, then his own bone marrow started improving and his hemoglobin platelets became normal and was discharged from the hospital. So in summary, this is a case of neuroblastoma, a very high-risk neuroblastoma, because the neuroblastoma spread all over the body, and he required a bone marrow transplantation which was done without any blood transfusion or platelet transfusion because of the faith of Jehovah's Witness which this family and the patient follows. That makes it very, very unique. Thank you very much.